Finally, I can see a tribe of Kiwis. Finally, get off your knees and live the last days on your feet. Finally, I can see how it is. Kia ora Kiwis, it's time to wake up. Another question for me regarding COVID-19 is the science really settled? Now, to answer that question, I feel that I need to also ask, is the medical community all in agreement? There are a lot of aspects to this virus, and the experts, the medical profession and the scientists, well, they seem to be arguing about everything. So what are they all arguing about? How you can catch the virus, i.e. droplets, talking, laughing, sneezing, coughing, circulating air, air conditioning, personal contact, how big, how far, pets maybe, public spaces, transport, surfaces, money. And how can you safeguard against it? Boosting the immune system, vitamin C, D, zinc, etc., washing hands, disinfectants, avoiding air conditioning, lots of fresh air, going out in the sunshine. Now, researchers say there is a clear link between vitamin D deficiency and the severity of the coronavirus. So I don't think it makes much sense to be stuck inside, degrading our immune system. Now, regarding social safeguards against catching the virus, there is debate and discussion about the need for masks, about social distancing, if it's necessary, and how much of it, what's the science. Meet here New Zealand's own Dr. Sam.
There have been no observational studies in real human beings to determine if social distancing works. Please let me emphasise that I am not
Quarantining of the infected, of course. About the lockdown, and certainly the lockdown of population, as opposed to the risk groups. And of course there's always the censorship of unapproved perspectives. Now, there is debate, mostly online, about the prevalence of infection, the death ratios, the antibodies in populations, and in some countries, with the different measures taken, the possibility of reaching herd immunity. For example, Sweden and in Belarus.
How sure are we? I've seen a number of studies, one from China that no longer appears to be available, and others that have come out since, that in the first place, the tests are not reliable. We're getting a lot of false positives. In the second place, some of the tests have been contaminated. Have you looked at that? Have you seen that information?
I've been working with diverse colleagues from early on, and again, trying to leverage the fact that I was getting lots of correspondence. Whether or not I was the right person to be getting it, I was getting it, and I wanted to use it every way I could. And a lot of that related to test kits. And what was obvious is it was chaos. It was unclear what test to use. It was unclear how good they were. And by the way, the scramble to determine what are the best kits, how do we most effectively disseminate them to the population at large, how do we find out who's infected now, and equally important, who was infected and is now immune, because the more we know about that, the greater our ability to gauge the promise of getting to herd immunity, which to me is the best prospect for all clear. And it's still a conundrum.
Here we have an excerpt from Dr. Ioannidis.
What was the purpose of that study, and what did you discover?
This study aimed to generate an estimate of how many people in Santa Clara County have been infected with the virus.
What are your conclusions based on your study?
If you compare the numbers that we estimate to have been infected, which vary from 48,000 to 81,000, versus the number of documented cases that would correspond to the same time horizon around April 1st, when we had 956 cases documented in Santa Clara County, we realized that the number of infected people is somewhere between 50 and 85 times more compared to what we thought, compared to what had been documented. Immediately, that means that the infection fatality rate, the chance of dying, the probability of dying if you are infected, diminishes by 50 to 85 fold, because the denominator in the calculation becomes 50 to 85 fold bigger. Our data suggests that COVID-19 has an infection fatality rate that is in the same ballpark as seasonal influenza.
Now, there's debate also about how dangerous is this infection in the different groups it affects. Also, the collecting and sharing of statistics by different groups, possible protective factors, of course, latitude, season, humidity, etc., the different symptoms in particular groups. Also, is there any possible benefit from having had the infection?
Most people will become infected by this, and most people won't even notice. We have data now from Sweden that shows that between 98 and 99% of the cases have had a very mild infection or didn't even realize they were infected.
There's also debate about the appropriate treatment, including preventative medication for mild, serious or acute cases. For example, IV vitamin C.
What do you see?
That our therapies are working. We use a combination of oral vitamins, vitamin A, C, D, and iodine, and then using nebulized hydrogen peroxide and iodine if they're a little bit worse. Then we're using IV vitamin C and IV peroxide. We are so far treating over 100 patients. All of our patients are better, dramatically better. No one's hospitalized, no one's been ventilated, and no one's died. We were ready for this when we knew it was coming. And we knew the therapies were going to work because we've treated influenza-like illnesses for the last 20 years, and we treated them successfully. So there are therapies out there that work. We don't have to have this fear level at 10 out of 10. We need herd immunity, and we need to get over this. Our average age is probably about 60 years old in our practice. And so we've seen very sick patients who thought they were dying. I've been putting the videos on my website, and these patients are getting better with these therapies.
Now, there's also whether we need a vaccine at all, and I have serious doubts whether a vaccine created at warp speed would be safe. Here we have Dr. Buttar and over 100 medical colleagues.
Okay, so raise your hand if you see blatant censorship that seems to serve a pro-vaccination agenda. If we just hold the hands up there. I'm just curious what this panel thinks. Okay, wow, all right. Okay, a lot of hands and thumbs up, okay. What do you see here? Let's go with support. Let's see support, and we'll just see if any hands go up. How many
people support the use of a vaccine, COVID-19, in the next year?
In the next 12 months. Okay, and hold the hands up, and if you do believe that, feel free to hold it up. That's okay. All right.
Nobody on the first page.
And you can see more of that interview on londonreal.tv. There are lots more issues of contention in the medical and science community. Sometimes it's not just the debate, it's the inconsistencies coming from the people put in charge.
So manageable numbers. Bottom line, we don't have to worry about this one, right?
Well, obviously you need to take it seriously and do the kinds of things that the CDC and the Department of Homeland Security are doing. But this is not a major threat for the people in the United States, and this is not something that the citizens of the United States right now should be worried about.
Dr. Fauci, great to have you with us. Thank you very much. I'd like to start with the question of these models, which are now getting a lot of pushback in terms of their reliability when the numbers have swung, 33% in just a couple of days. What do you say to Andy McCarthy, who wrote that piece?
Well, I mean, there's a certain validity to it. I have been and still am and will always be somewhat reserved and skeptical about models because models are only as good as the assumptions that you put into the model. And those assumptions that start off when you don't have very much data at all, or the data that you have is uncertain, that you put these assumptions in and you get these wide ranges of calculations of what might happen, 100,000 to 240,000 deaths. But then as you start to accumulate data that's real data, are likely being influenced heavily by the mitigation programs that you put in, the physical separations, that when real data comes in, then data, in my mind, always trumps any model. And you have to modify the model and the assumptions as you get data in.
Now, isn't it interesting what some of the prominent people say in public, they ignore in their private lives? I believe a couple of Kiwis fall into that category, our own Minister of Health, Dr. David Clark, and the Far North's Dr. Sullivan, so-called New Zealander of the Year.
Examples of recent computer modelling gone wrong is from the Imperial College of London, who estimated the risk of infection and death from coronavirus to be 131 times greater than it actually has turned out to be.
It's also interesting the tech companies being very heavy-handed with censorship these days, and who gave them the monopoly on truth.
So we talk about that as raising authoritative information. But then we also talk about removing information that is problematic. Of course, anything that is medically unsubstantiated, so people saying like, take vitamin C, take turmeric, like those all will cure you. Those are the examples of things that would be a violation of our policy. Anything that would go against World Health Organization recommendations would be a violation of our policy. And so remove is another really important part of our policy.
Right, folks, there's a lot to this topic, so we're just trying to chip away here. But in the next episode, we'll try and dial in on maybe a particular issue. I'm just a Kiwi dad wanting to help create a better future for our kids' generation. So my last question is, are we sheep, or can we think for ourselves? But for now, Kiwis, people have asked me why I'm sharing articles on this topic and encouraging you to take an interest in the science that gets touted about. Well, here's someone who can say it much better than I can.
A hysterical slide into a police state. A shameful police force intruding with scant regard to common sense or tradition. An irrational overreaction driven by fear. These are not the accusations of wild-eyed campaigners. They come from the lips of one of our most eminent jurists, Lord Sumption, former Justice of the Supreme Court.
Hysteria is infectious. We are working ourselves up into a lather in which we exaggerate the threat and stop asking ourselves whether the cure may be worse than the disease.
There will be people listening who admire your legal wisdom, but will also say, well, he's not an epidemiologist. He doesn't know how disease spreads. He doesn't understand the risks to the health service if this thing gets out of control. What do you say to them?
What I say to them is I'm not a scientist, but it is the right and duty of every citizen to look and see what the scientists have said and to analyze it for themselves and to draw common sense conclusions. We are all perfectly capable of doing that, and there's no particular reason why the scientific nature of the problem should mean that we have to resign our liberty into the hands of scientists. We all have critical faculties, and it's rather important in a moment of national panic that we should maintain them.
Lord Sumption, former Justice of the Supreme Court.
Righty-ho, Kiwis. If you like this, press the like button, share it around to your friends, and also the links are in the video header. Oh, the gold, it's what we're told. Just make money, then grow old. Now the game is up, I see through it all. The banks rob us blind, then let us fall. But finally, I can see a tribe of Kiwis. Finally, days on your feet. Finally, I can see, yeah, how it is, the sleight of hand. Finally, yeah, we can see, yeah, if we open our eyes, the shady plan. Finally, get off your knees and live the last days on your feet. See the truth and live those last days debt free.